Welcome back to Blocking the Flame, Anakinra and COVID. I'm your host Gaganasri, and this is episode 10, Combining Therapies. Anakinra with Steroids or Tocilizumab. We have spent the last few episodes exploring Anakinra's role in managing inflammation in COVID-19, like a firefighter battling a blaze at its roots. But today, we will be discussing a more intricate approach, combining therapies. Specifically, how Anakinra interacts with steroids and tocilizumab, two other heavy hitters in the fight against severe COVID-19. Joining us to unpack this dynamic duo is Aseema. It's great to have you here back.
Thanks, Gaganasri. It's exciting to discuss how combining these therapies could help put out the fire that is the cytokine storm in COVID 19.
Absolutely. Let's set the stage first. We know that steroids like dexamethasone and tocilizumab, an IL-6 receptor antagonist, have been used in treating severe COVID-19. But how do they work on immune system and what makes them so valuable in severe cases?
Steroids like dexamethasone are essentially immune system dampeners. They step in and suppress the immune response, preventing it from spiraling out of control. In case of severe COVID-19, this helps to quell the cytokine storm, essentially stopping the immune system from overreacting and causing tissue damage in organs like the lungs. Tocilizumab, on the other hand, specifically targets IL-6, which is a cytokine that plays a significant role in driving the hyperinflammatory response that leads to acute respiratory distress syndrome or ARDS. And by blocking this IL-6, tocilizumab helps to stabilize the immune response and restore lung function in patients who are critically ill. Both therapies are crucial in the right context, especially when inflammation has already reached very harmful levels.
So steroids and tocilizumab are like two different firefighters targeting different aspects of staging fire. Would you see that?
Yeah.
One dousing the flames of inflammation while the other focuses on specific hotspots. But how does Anakinra fit into this firefighting squad?
Okay, so I must say that's a great metaphor. Anakinra targets a different source of the fire. So it inhibits IL-1, which is another critical cytokine in the inflammatory cascade. IL-1 often acts as a spark that ignites that cascade, leading to widespread inflammation. And by inhibiting IL-1, Anakinra can help prevent the inflammatory storm from escalating to dangerous levels, protecting organs from further damage. And when you combine anakinra with steroids or tocilizumab, you are essentially using multiple fire extinguishers targeting different flames in the inflammatory process. And this multi target approach can enhance the control over inflammation, potentially leading to better outcomes in severe COVID 19 cases.
Well, so Anakinra acts like a tactical firefighter, cutting off the initial spark before it can turn into a wildfire. While steroids and tocilizumab focuses on the flames already raging. Is there clinical evidence to suggest that combining these therapies is effective in COVID-19 patients?
Well, yes, there's been quite a bit of research on this combination approach. Some clinical studies have examined using anakinra alongside steroids, especially in patients with severe COVID 19 pneumonia. The results suggest that this combination can lead to reduced inflammation, improved oxygenation, and quicker recovery compared to steroids alone. Similarly, when anakinra is combined with tocilizumab, especially in patients with severe cytokine storms or ARDS, the early data shows really promising results. Patients seem to experience faster symptom resolutions and, in some cases, even reduce mortality. However, as you know, Gaganeshri, more well controlled studies are needed to determine the best timing, dosage, and safety profiles for these combinations.
It's like adding more tools to the toolkit, each working at different stages of the inflammatory response. But timing is everything, right? Is it critical to use these combinations early, or Can they still be effective in the later stages of the illness?
Well, yeah, timing is really crucial in ensuring that these treatments have the maximum benefit. For Anakinra, early intervention is key. When used early, it can prevent the inflammatory response from escalating into a cytokine storm, much like catching a fire while it's still small. And steroids and tocilizumab work best in later stages when inflammation has already taken root. Dexamethasone, for example, shows its best effect in moderate to severe cases where patients are already experiencing hypoxia and have elevated levels of inflammatory markers. Thus, while anakinra is best when it's used early, the combination of these therapies at the right time in the disease's progression can offer synergistic effects, targeting the inflammation at multiple levels.
Striking a balance between early intervention and preventing further escalation is crucial. But of course, combining therapies raises the concerns of risk. Are there any dangers in using anakinra with steroids or tocilizumab?
Yes, there are some risks that we should be mindful of. The most notable is the potential for increased immunosuppression. Both anakinra and tocilizumab can dampen the immune system's ability to fight infections. When combined with steroids, this effect could be amplified, making patients more susceptible to opportunistic infections. Additionally, we need to consider the risk of oversuppressing the immune system. Blocking IL-1 and IL-6 simultaneously may impair the body's ability to combat the viral infection itself. So careful monitoring is really necessary to avoid weakening the immune system, too much. Ultimately, while the combination of anakinra, steroids, and tocilizumab holds promise, it also needs to be personalized to the patient with close monitoring to ensure that the immune system is balanced, that is, it's neither too suppressed nor too overreactive.
I understand. It's a delicate dance between quelling the storm and ensuring the immune system can still protect the body from the virus.
Yeah.
Before we wrap up, Aseema, what does this future of combination therapies look like, both for COVID-19 and other diseases like with similar inflammatory pathways?
Well, the future of combination therapies is really bright, Gaganasri. In addition to COVID 19, this approach holds potential for a range of diseases from autoimmune disorders to sepsis and even cancer. By targeting these multiple points in the inflammatory pathway, we could provide more effective treatments and reduce the need for broad immunosuppression. And with advances in personalized medicine, we may also be able to tailor these combinations to a patient's unique immune profile, ensuring that the treatment is just right for them. So, the hope is that as we understand more about inflammation and immune responses, combination therapies will become a cornerstone of treating not only COVID 19, but also many other diseases where inflammation is a key driver.
Thank you so much, Aseema, for your insights into the potential of combination therapies. It's clear that combining these treatments can be powerful to tackle severe inflammation, but we must strike the right balance to ensure the best outcomes. In our next episode, we'll turn our attention to pediatric COVID-19 and MISC. Anakinra has been explored in younger patients, but how their immune profile differ and what special considerations come into play. We'll explore that next time. As always, this podcast is for educational purposes only, and for any clinical concerns, please consult a healthcare professional. Until next time, this is Blocking the Plane, Anakinra and COVID. Stay tuned.